This video summarises one of the PEDro top 20 trials. The trial was led by Neil Greening and investigated the effect of an early exercise intervention in people hospitalised with an acute exacerbation of a chronic respiratory disease. Chronic respiratory conditions are responsible for a large number of hospital admissions. Following hospital discharge, pulmonary rehabilitation is encouraged. At the time of this trial, there was little information about when exercise should commence. The aim of this trial was to estimate the average effect of early exercise compared to standard care on the risk of readmission in people hospitalised with an acute exacerbation of a chronic respiratory condition. 389 participants were recruited, with the main inclusion criteria being hospitalisation with an acute exacerbation of a chronic respiratory condition. Participants had to have a Medical Research Council Dyspnea grade of 3 or more. 196 participants were randomised into the early exercise group and 193 into the standard care group. Allocation was concealed. The early exercise group started exercise within 48 hours of admission. The daily supervised exercise program consisted of progressive walking, strength training for upper and lower limbs, and neuromuscular electrical stimulation. Following discharge, participants followed an unsupervised exercise program of daily walking, electrical stimulation, plus self-management support. The standard care group received usual care and were offered outpatient pulmonary rehabilitation 3 months after discharge. The primary outcome was the number of participants who had an unplanned readmission to hospital over the 12 months following their original admission. Assessors were blinded to the treatment allocation and intention to treat analysis was used. 62% of participants in the early exercise group had an unplanned readmission to hospital compared to 58% in the standard care group. The hazard ratio is 1.1 with a 95% confidence interval of 0.86 to 1.43. So the effect of early exercise on the risk of hospital admission lies somewhere between reducing risk in relative terms by 14% and increasing risk by 43%. Early exercise during a hospital admission for a chronic respiratory condition did not reduce the risk of subsequent readmission, probably because of the low dose of exercise. A Cochrane review concluded that pulmonary rehabilitation commenced soon after discharge for an acute exacerbation of a chronic respiratory condition does reduce hospital readmissions, so early attendance at pulmonary rehab should be encouraged.